Hello, everybody, and welcome back to the Parkinson's Disease Education Podcast. This is episode 2 of our series on communication disorders and Parkinson's, what happens and why. This episode is about speech therapy for Parkinson's disease, which will include LSVT Loud, Speak Out, and other core voice exercises. On the other side of the intro, we're going to be diving into those topics, telling you about all of that. So stick around, don't touch that dial. We'll be right back. Welcome to the Parkinson's Disease Education Show, where we demystify the disease and empower you as the person with Parkinson's disease to reach your true potential. The content contained on this show is for informational purposes only and is not meant to be a replacement for information or advice that you receive from your in-person medical or therapy professionals. If you haven't already, I hope you'll consider subscribing, and for an even more personalized experience, please ask us about our memberships. Now, without further ado, let's start the show. Okay, well, Sarah, welcome back. And as we discussed last episode, this is going to be a what do we do about that kind of episode, even though it's certainly not the last of the series. But we're going to be talking about, as we mentioned in the intro, direct therapy treatment protocols and other core voice exercises. So let's talk about the main ones, which would be LSVT Loud and Speak Out. I think it'd be important to kind of compare and contrast these protocols and give a little bit of a history as well of where these came from. I know I could speak to Loud a little bit more than I can Speak Out. So if you have more knowledge about some of that, let me know. But yeah, so I'll let you take it from here as far as the LSVT protocol first.
So LSVT Loud stands for Lee Silverman Voice Training, and Lee Silverman was simply the first client that they tested with this protocol.
Mm-hmm.
So LSVT Loud is considered the gold standard in Parkinson's voice treatment in direct therapy, the direct therapy approach. It's been around for decades and decades, and it has the most robust research behind it as far as improving vocal loudness, voice quality, even clarity of speech. There's some research that also suggests that it can help with swallowing function as well.
Mm-hmm.
Intonation in the voice, which we know with Parkinson's, the voice can also become very flat and monotone sounding. So LSVT Loud is a very intense protocol. The standard protocol is that it's 1 month of treatment. And in that 1 month of treatment, you would see the speech therapist 4 times per week for 4 weeks in a row. So 4 1-hour sessions. So let's say you might have Monday, Tuesday, Thursday, Friday. On the days that you have your direct therapy with the speech pathologist, you'd have a little bit of homework. On the days that you don't have direct therapy, there's even a little bit more homework. So I always tell people that if you're going to do the LSVT Loud program, clear your schedule because it is very, very intense. It's going to take a lot of your focus and effort during that 4-week period. But the results are, they speak for themselves. Depending on where you are, you have to look into whether or not there's coverage for that, depending on what state or province or where you come from in the world. But there is, we'll link below, I think, Michael, the clinician directory for LSVT
Yes,
Loud.
we can do that for
if
sure.
anyone wants to search for LSVT Loud certified speech therapist.
Yeah, and you can search for quite a wide range of geographical range.
Yeah.
Usually you'll find somebody, well, I say usually, most often you'll find somebody in your own town, but you could even look up to, I think it's 100 miles, statute miles.
Yeah, you can put in a search criteria. It's also important to know that it's also offered, it's called E-Loud. So there's a virtual option, and many clinicians are now certified in the E-Loud protocol, which is exactly the same. It's just offered via teletherapy instead of in person, which is nice because it really reaches those people in farther out, more remote locations or people with reduced mobility.
We're not going into the physical or occupational therapy in this episode, but just to mention briefly, I've been LSVT Big certified since 2013, and it was developed piggybacked off of the speech therapy protocols that were developed for LSVT Loud. So the dosing is the same 4 times a week for a month, and we just are working on the limb system, balance, flexibility, um, transfers, gait, all of that stuff. So, but yeah, as Sarah mentioned, it's definitely the most evidence informed practice that exists today, and the results do speak for themselves. And I can tell you from personal experience that is the case on the therapy PTOT side, I should say. But one thing I would say too is Speak Out was developed at a point when I think Speak Out was developed a little bit later.
It
And
was.
one contrast I can tell you without asking Sarah is that Speak Out is not, it is a protocol, but is not as, I guess it is a protocol. It's 3 times a week for a certain length of time. I forget how many weeks, but
Same amount of time. So 4 weeks, and it's typically 2 to 3 times a week for
okay, 2 to 3.
45-minute
A
sessions.
little bit more flexible and less
A little
length
bit
of
more
time.
flexible. Yeah.
Hmm. And the the catchphrase with Speak Out is speak with intent.
Yeah. So
Um,
that's one of the main differences between the two programs is LSVT Loud is really about thinking loud.
thinking
So
loud. Hmm.
when you're doing your exercises, when you're speaking, when you're doing your functional phrases, you are always trying to be a little louder than feels necessary. And the reason for that is because the lack of dopamine in the brain in Parkinson's results in this faulty feedback loop where your brain starts giving you false information. It starts telling you that your actions are big in amplitude. So your voice is big, your movements are big, when that may not be the case. So you
Yeah,
may be thinking that you're speaking nice and loud as we're speaking right now, but maybe your voice is actually like this. But your brain says, "Great job, Sarah. You're speaking perfectly loud. Keep it up." So you don't do anything to change it. So to compensate for that with the LSVT program, we're overshooting what we think is normal in order to come out at probably an appropriate leveled voice. So that's the LSVT Loud program, the Speak Out program, as you mentioned. The focus is on very deliberate, purposeful, intentional speech. So their motto or mantra is speak with intent. And the science behind that is that when we are on automatic pilot when we're speaking without much thought, our system runs through the dopamine deficient basal ganglia. But when we do
hmm,
something very intentionally, where we have to really think and be focused on everything we're saying, we don't run through the dopamine deficient. So we're not at the mercy of the dopamine deficiency. So it's kind of a bit of a neuro hack in that you can be louder and clearer when you, and I always liken it to learning a new language. So
yeah.
so Michael, do you speak Italian?
No, Spanish. I know some Italian words, but I don't speak it fluently by any
Okay.
means.
So let's take Italian or Spanish. Let's say you're trying to speak one of those languages. Would you be able to just speak without any conscious thought?
No,
No,
not at
because
all.
it's not your native language. You
Right.
everything you said would have to be very thoughtful, deliberate with a lot of focus and intent. Okay? So that's the amount of effort the Speak Out program wants you to speak when you're speaking your own
Yeah.
native language, right? That's the level of focus. Because as soon as you start speaking without any thought, then all of a sudden you're using your automatic system in the brain, which is not going to give you that nice, loud, clear speech.
Yep, that makes sense.
Hmm.
I guess a question I would have to follow up on comparing and contrasting the two is, and I know you're dual certified in those two programs. Um, and I know we're not pitting them against each other in any sense, but just was curious of what you find helpful about one versus the other, or what preferences you would have. Like, I guess who's a better candidate for one or the other is a good question.
Yeah. When I did work clinically as a speech pathologist, I had clients for both LSVT and I also did speak out. Um, what this is my personal opinion, just based on the clients that I saw, but anyone that has a significant voice loudness or voice quality issue, I found LSVT loud to be superior. For anyone that had more of an articulation or a fluency issue, so maybe that really fast, cluttered, festinating speech,
Hmm.
I found the speak out method to be a better approach for those people. But if the primary
Interesting.
concern is the vocal loudness and the voice quality, then in my opinion, LSVT loud was superior.
Do you have any thoughts on why that might be? It was particularly with like the cluttering and other disorders like that?
Well, I think with the cluttering, with the
Fluency?
and just so people understand, cluttering is really kind of fast, uncontrolled, almost stuttery. That's maybe the best
Yeah.
term to describe it. Type speech. The speak out method really focuses, because you're really focused on saying every word with intent. It slows you down, and it
Hmm.
makes you say each word before moving on to the next one, because it's really
Okay.
focused on saying every word very deliberately. And I think for someone that has more of a fluency or
Yeah.
an unclear speech, that's really, really helpful.
When that gives you a more of a pre-planning cognitive component
Yep.
to it as well.
Yep.
Okay. That makes
Yeah.
sense to me. So, Sarah, would you be able to give us an example of what kind of the core exercises might look like?
Yeah, so across any of the direct therapy programs, or if you're seeing a speech pathologist and they're doing sort of a hybrid program, or they're pulling, their own, expertise and experience into the treatment plan, there are two exercises that you will always see, and I call these the broccoli and the Brussels sprouts, or the bread and the butter. Like, they're always included. And those two
Hmm.
exercises are, number one, the long, loud ah. So that's, sitting tall and doing an ah with a nice open mouth for as long as you can with good voice quality. Projected, a really good intentional projected voice. So not there has to be some oomph behind it. But never ever pain or strain. You never want to damage the vocal cords. So that's the long, loud ah, and it's very drill like. You do a number of them over and over and over again with, little pauses in between to catch your breath. And then the second one is pitch exercises. So you're starting low and you're gliding up high on an ah, like ah. And I don't know if Zoom tried to mute me out there, but and then
Nope.
you're doing high to low. So, and the reason you're doing those pitch range exercises with lots of effort is because I think we mentioned this previously, that your speech in Parkinson's can become very monotone. So there's not
Yeah.
a lot of change in the intonation in the voice, and so you're trying to get more vocal range in your voice by doing those ups and downs. And those are the two main, they're very drill like, but those are the core exercises that are involved in any direct voice treatment for Parkinson's.
Okay. Well, for those that are familiar with any speech principles or speech language pathology terms, I believe that would be prosody that you're working on, where
Yes.
it's you're getting
Yep.
the pitches, because prosody, and you see this in infants learning to talk,
Hmm.
is there may be a complete nonsense verbiage coming out of a baby's mouth, but it might have a question mark on the end.
Yep. Yep.
Because our voices, in almost, I think, universally, pretty much in every language, it seems like, if I remember right, um, we will our voices will go up in pitch at the end if we're asking a question.
Yeah.
So, um,
Yeah, I mean, prosody, think of it as the musicality in your voice. It's really
yeah,
what gives your voice flavor and interest and gives information. Like you said, is it exclamative? Is it, really sharp at the end? Is it going up on a pitch as if it's a question? Yeah, there's a lot that goes into the those sub features of our, it's not just our voice and our speech, but those underlying
yeah,
intonation patterns that give a lot of communication information.
yeah. And as we mentioned in the previous episode, it somebody may come across as bored or uninterested, especially if they sound a little bit more monotone. And on top of that, they may have the nonverbal facial expression,
Yeah.
paralysis of the face. So if they're talking monotone and they kind of look deadpan like this, you know, you're gonna think, what's wrong with this jerk? But
Yeah.
they're not doing it on purpose.
Yeah.
And but again, this is something that can address that. And actually, something with LSVT loud, I can say from the big protocol as well, is we would say it has a spread of effects. So with LSVT loud in particular, you may be addressing the volume of speech, the
Mhm.
intelligibility, but the spread of effects would include improvement potentially in facial expression because
Yeah.
and in speak out as well. I want to be fair, but with these, especially with loud, with these programs, you're trying to, when you put out that higher effort to really do the sustained ahs or the high to lows,
Yeah.
um, you're going to be opening up your face more and purposefully, and it may take a lot of effort to do that with
Mhm.
Parkinson's. So you may be even more exaggerating it, and that actually can help your facial expression as well.
Yeah, and there's actually some really exciting research from LSVT that shows that these exercises, when done correctly, repetitively, in a very drill-like fashion, actually makes changes to the motor cortex of the brain, which
Yes.
then there's that trickle-down effect where it can improve articulation and facial movement,
Yep.
swallowing function, all of those things.
Yeah, it's really pretty neat to see.
Hmm.
So we kind of talked about looking up clinicians on the LSVT database. I guess, do you have any other advice for people on how to access therapy depending on where you are in the world?
So, going directly to those two companies, so LSVT Global is the website,
Mm-hmm.
and we'll link these down below.
Link these are down below. Yeah.
LSVT Loud, and then Speak Out is through the Parkinson Voice Project, which we
Mm-hmm.
can link a clinician search down below. But in general, when searching for speech pathologist, just in general, depending on the country you are in, or the province or the state, there are databases for speech pathologists, and you can specify, works with adults, works with people with neurological conditions. But if you're specifically looking for those protocols, it's probably best to go directly to their websites, as they're going to have the list of all of the speech therapists who are actually certified in those protocols.
Right. Yeah, that's my best advice too. Is just to link to those clinician databases because, and as one disclaimer is that you have to make sure that the clinician is still current because once in a while they're still listed and they may not be actively practicing those protocols. But that being said, it will give you a list of those different clinicians in your local area.
And just
Um,
reaching out, I mean, you can reach out and ask those questions. How often do you work with individuals with Parkinson's? How
yeah,
often do you do this? When was the last time that you did it? You can be direct and ask those questions. You definitely want someone that does this on a regular basis and not just as a one-off. You want someone
yeah,
that's well versed and experienced in these protocols.
for sure. And it's harder to gauge this, but I would also argue that it would be important to find a clinician that really enjoys doing this
Yeah.
and in
Yeah.
treating this population of people. Because
Absolutely.
if you have a passion for it, you're going to find a really good therapist.
Yeah.
If your therapist has a passion for it, I should say.
Hmm.
Um, so we've talked about the skilled therapy needs and how to basically find those clinicians. But one of the problems that you will find often in physical therapy, OT, but also in speech, is that after, and again, we talked about the first episode, we talked about motivational issues. We talked
Yeah.
about continuity and continuing home exercise programs and being motivated to do what you need to do, even when you know what to do. There is a potential solution we wanted to talk about with you briefly. We're going to talk about it more in the future, but I wanted to mention the Get Loud, Stay Loud program and how it could fit in as ongoing practice, guided practice, and support for you and your loved one with Parkinson's, you as a person with Parkinson's, or if you're a caregiver or care partner, where to guide your loved one with Parkinson's to get some help after therapy is over.
Yeah. So, um, one of the drawbacks of direct therapy is, of course, that it ends, right?
Yeah.
So, when you do your month of direct therapy, you make these amazing gains, and then you are given the exercises, which are probably only about 10 or 15 minutes. And you're told, do these every day for the rest of your life, because we know Parkinson's is lifelong and it's degenerative. It's not something that you can make all these gains during a month of therapy and then not have to do the exercises anymore.
Yeah.
And as you said, Michael, and we've talked previously in the first podcast that 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 motivation, self-motivation is one of the most difficult things for people with Parkinson's. So to give them a voice exercise protocol to do on their own can be really daunting, and not many people follow through with it. So because of
Yeah.
that, I created something to meet that need for these individuals. So whether you've done your direct therapy and you just want some way to stay consistent and motivated with doing the exercises, or maybe you geographically and financially you don't have access to a direct therapy, a burst of direct therapy, but you want to be able to do something at home. You want to be doing home exercises that are guided. They're you're doing them the right way. You're having that professional expert guidance. So the Get Loud Stay Loud program is a membership program that you can sign on monthly or annually, and you just tune in and follow along to the instructor leading the class through all of the exercises that you need to do in order to to keep your voice loud, to keep your speech clear. There's even classes for that specifically address facial masking. There's role
Hmm.
play exercises, cognitive classes for anyone that's really struggling with with the cognitive linguistic, drawbacks or side effects of Parkinson's. So
Yep.
lots of variety, lots of ways to tailor the classes to your needs, and they can be attended either live or on demand. So it's very, very flexible.
Yeah, it's a fantastic option. And you do offer a trial, I think, at the beginning.
It is. Yeah, there's a free month trial for anyone that wants to have full access to the program, unlimited access. And if it's something you want to continue with, you just continue on with either a monthly or annual membership. And the cost is very reasonable. It's something that we keep the cost low because we know it's something that people will have to do. Um, you know, for long term. It's not something that you can
Hmm.
just do for 3 months and then not do again. It's like kind
Right.
of like going to the gym. You can't work out at the gym really hard for 2 months and then not work out and expect you're going to keep those gains.
Absolutely. Yeah. And this isn't the first or the last time we're going to mention Get Loud, Stay Loud, but we did want to mention that during this episode when we already talked about formal therapy programs for Parkinson's and what's next after that.
Yeah.
So that
Yeah.
is certainly one excellent option for you of what to do next. So we're going to leave a link in the description below to that as well to check out if you're interested. But this isn't the last episode. We have, by count, 4 more. The next episode, we're going to actually be talking about something most people don't realize. And we kind of touched on this in this episode when we mentioned swallowing. As you've guessed, the muscles of swallowing are also affected by Parkinson's disease, just like every other muscle in the body. So the same muscles you use for speaking are also responsible for swallowing. In the next episode, we're going to be breaking down what happens to swallowing in Parkinson's disease and why it matters more than you might think. Because on the surface, you might think, oh, yeah, it's not good to not swallow your food right or to cough when you drink liquid. Well, there's some big issues that can happen that we're going to talk about in that episode. So stick around for that. And we are going to be covering that topic when the next episode drops. Any concluding words, Sarah, before we wrap this one up?
No, just that there's so many more exciting topics we have on the agenda, and I'm really excited to be here for it all.
I'm here for it too, and it's definitely exciting to be able to talk about this in long form and break down these important topics
Yeah.
one at a time. So, thank you for being here with us again, Sarah, and everybody watching and listening. Thank you for tuning in. If you haven't subscribed already, it doesn't cost anything. It's easy to do. You just hit that subscribe button. You get notified of upcoming episodes and any updates on the channel. And of course, if you're in podcast form, following just gets you the new episodes as soon as they drop. Um, if you haven't had a chance to yet, please leave a review. If you're listening on podcast form, if you're on YouTube, please do like this video, share it with other people, and especially anybody you think could benefit from the information. So thanks for being here. We'll see you in the next episode. As always, be empowered. Catch you next time.